Welcome, or welcome back, health advocates. Have you ever noticed that telemedicine has been around forever? However, nobody has really utilized it up until we had to. Telemedicine has so many benefits as it saves people on gas, time off of work, elder or child care. So have you ever asked yourself why telemedicine hasn't taken off years ago? In this video, I'm going to share with you the fine print in telemedicine and why people are hesitant to use it, even to this day, especially when it comes to those with complex chronic conditions. This video was created for those with mild, progressive, or advanced conditions that need continuous care and needs telemedicine in their lives. But no one has sat them down to discuss in detail how they can go about doing this in a step-by-step guide as I'm doing today. And after watching this video, you will feel more confident in participating in a complex telemedicine visit with your health professional and utilize their telemedicine offering the right way. And if you haven't done so already, please go to the Remote Companion for Self-Health Management and turn to section 3.1 and 3.2. And if you don't have the book, please go to the description box below. I have included all of the tools and information that you will need to follow along. And if we haven't met before, hi, my name is Jennifer. I'm the creator of the Patient Better program. Welcome to my channel. This channel was created for everyday people such as patients, families, and caregivers, just like yourself, to learn how to manage care more easily and independently. And if you haven't done so already, share this video with someone that could benefit from watching, as well as click the subscribe button and bell to be the first to get notified for the best tips and tools to self-manage care. In this segment, I'm going to share with you how to connect medical services to federal and state requirements, insurance guidelines, and compliance issues to telemedicine and what they all mean. First, I wanted to share with you some statistics about telemedicine's necessity, because 20% of Americans with chronic conditions live in rural areas, whereas only 9% of the specialty health services are delivered. Many believe that telemedicine may be the answer to help connect these rural Americans with limited access to care to the specialty care that they need. It is speculated that telemedicine may be the answer to reduce unnecessary spending, further accessibility, and increase the physician's and the patient's ability to monitor chronic conditions more closely. The demand for specialized care in rural America is highly desired. In summary, one source even stated that among 11 industrialized countries, the United States ranks the lowest on the measurements of care regard to efficiency, accessibility, and equality. As it stands today, the American Telehealth Association is the only known organization that completely focuses on accelerating the adoption of telemedicine. Some healthcare professionals are concerned that their patients may not acclimate to the offered virtual services. The future of funding and support for telemedicine after the pandemic is yet to remain unseen. Some believe that patients are not responsible to care for themselves after an in-person consultation. Then surely, the level of interest will drastically decrease with virtual appointments. We will go on further to discuss this in detail later, but as it stands today, the common belief is that virtual communication remains more challenging than interacting face-to-face. Now, what I have to say next is really important for you guys to know, I promise you. Nobody has been able to shape this in the way I have been able to today. Now, for healthcare providers and insurers, virtual healthcare concerns, for the most part, are the same as in-person concerns, with only one difference. Virtual healthcare concerns, for the most part, are the same as in-person concerns, with only one difference: the distance. Telemedicine should benefit the patients, the providers, and the insurers alike. and should have some sort of benefit in telecommunication. As it pertains to healthcare professionals, they need to benefit from their expanded services, but they also need to make sure that it is a right fit for their practice. But as far as reimbursement is concerned, telemedicine service fees are not as straightforward as traditional in-person medical service for one reason: the lack of patient data to support the encounter. Now, we are going to address this in the next video because it pertains to you. And here is the biggest number one problem in a nutshell. For various reasons, patients are not providing their vitals, which limits the physician's ability to empirically treat and document medical necessity to insurers. As we discussed in the last video, chief complaints, the Federation of State Medical Boards is an organization that guides physicians in licensing, disciplines, and regulations. The FSMB set the standard for telemedicine services must adhere to and recognize as the same standard as in-person services. When technology and healthcare collided itself into fruition at the time, it made the experts realize that the optimal solution for virtual encounters would be to equalize real-time visits to the already structured in-person appointments. Since parity was already established, it made it easy to formulate telemedicine guidelines around the already rooted regulatory and administrative requirements. And this is what my next video is titled: Acquiring a Virtual Health History, Vitals, Chief Complaints, and an Optimal Treatment Plan is inspired from. Now let's get into healthcare parity laws. Within the world of telemedicine, a parity law is defined as the diagnosis and treatment of patients in a remote area transmitted over distances through telecommunication. Parity, in short, means equal. Now the word law refers to a set of rules and principles entrenched in a community by respective authorities as applicable to its society and enforced by a judicial decision, whether in the form of legislation or in customs and policies. Healthcare parity laws pertain to both face-to-face encounters as well as telemedicine services. The idea behind structuring healthcare laws in this manner is to recognize that both in-person and virtual services are the same or equivalent to traditional medicine delivered inside the doctor's office and must meet the same documentation requirements as well. State parity laws, which are laws in healthcare that rest on the state level, in which practitioners must deliver services within the same standards of virtual medicine care as in in-person care services. Medicaid and private insurance companies are expected to reimburse virtual healthcare professionals the same as in-person service providers. The standard also includes medical necessity determinations by physicians, and the criteria of the individual health plans must also be equivalent. Services must be reasonable, necessary, and appropriate. And like the in-person visits, you must plan coverage approval. Your plan's coverage approval is the same. Your plan's telemedicine coverage approval is usually the same. For private payer coverage insurance, denials are applicable. Denials are available upon request. Federal parity laws are laws in which the federal insurer, Medicare, sets guidelines in which they commit to follow and display them on a public forum in effort to lead by example. Now about the federal healthcare parity law. In 2012, with the Affordable Care Act in action, the federal government made its first move to encourage telemedicine services to be included in coverage. These remote services are implemented only under a select circumstance at the federal level through Medicare. However, Medicaid, on the other hand, remain within the powers of the individual states. Here is a list of guiding principles for federal policy. To reduce and remove barriers to telemedicine, including geographic discrimination and restrictions for managed care. Prevent new barriers, such as rules that force higher quality standards for telemedicine as compared to in-person care. Encourage the use of telemedicine to reduce health delivery issues, such as provider shortages. Enhance commuter choice, better outcomes. Provide convenience and increase satisfaction. Medicare's telemedicine services were offered to patients who live in rural areas. Now, back then, Medicare's telemedicine services were offered to patients who lived in rural areas. The idea was that the specialist provided a satellite office in their outlined area with a connection to the main practice. The benefit to the patient is that they only had to travel minimally scaled to the nearest office of their home. The satellite office had the communication equipment in place and the medical assistant to usher in, check vitals, and connect the patient to the practitioner. This form of synchronous communication is referred to as hub and spoke. However, on March 6, 2020, in the wake of the virus, Medicare agreed to pay for all telemedicine services without the previous hub and spoke restrictions. It means that while the emergency is going on, most, if not all, Medicare patients will have access to in-network telemedicine services in a real-time remote setting right from their home. In other words, the patient is no longer required to travel to a satellite office. The telemedicine visit can be conducted in the comfort of home, and Medicare will reimburse even with a limited health history. The policy landscape from state to state is continuously in a condition of flux. There is always a juggle to balance laws and policies regarding reimbursement through state programs and commercial payers. State laws govern commercial payers' policies. The implementation and use of telemedicine vary from state to state, regardless of what service providers will be reimbursed for. Now, the state, likewise, governs what kind of parity characterized as equal treatment in services, which is normal, between the in-person health service reimbursements and the telemedicine reimbursements. This variety influences suppliers' capacity to actualize telemedicine choices, hence decreasing these services. This does not help patients become less confused or more at ease with telemedicine processes. As a result, telemedicine faces considerable obstacles in becoming accepted by patients to expand the doctor's office's telemedicine's offering. And until then, states in the nation cannot fully realize the cost-effectiveness of telemedicine. Each state has developed its own telemedicine parity laws, which means that along with Medicaid, commercial and private payers must also follow state telemedicine guidelines. If a plan must follow already established federal parity laws, this treatment will limit the payment amounts that must be covered equally, which would be the following: inpatient in and out of network services, outpatient in and out of network services, partial hospitalization, residential treatment, emergency care, prescription drugs, copays, deductibles, facility types, provider reimbursement rates, and clinical criteria used to approve care. Suppose there is an established parity law in a state as compared to an already secured federal parity law. In that case, it means that the private health insurance health insurance plan must follow state regulations, as the federal parity may only make inclusion for optional benefits. Federal parity may replace state law only when the state law hinders the application of federal requisitions. For instance, if a state law demands coverage for certain health conditions, then the federal requirement of equal coverage will surpass the weaker state law. Now, in order for you to participate and continue to receive telemedicine, you must be able to document vitals within a limited time prior to the virtual encounter. After the healthcare professional services meets the standard of federal and/or state regulations and insurance plans, they are ready to offer telemedicine services. If the adaptation of recently lifted telemedicine regulations is followed appropriately, the belief is that even though some services may be implemented, others may not. Like in-person services, a review must be completed for each encounter. If the vitals are not properly documented, and we must start this by doing it now, the encounter may be determined by insurances that the encounter is incomplete. Therefore, it is imperative for patients to understand and follow the guidelines and keep up to date with the insurer's requirements. Now, under a 1135 waiver, the location of the patient and the provider, as long as they are in the same state, the location of the session is irrelevant. Under normal circumstances, and let's say the state of emergency is lifted, all the same guidelines of insurance reimbursement approval remain in a virtual appointment as it does an in-person encounter. However, when this particular waiver is reinstated, it may be that the virtual appointment will not be reimbursed for lack of vitals. It may be that insurance may go back to the previously recognized guidelines of the hub and spoke synchronous communication that may be reinstated. I mention this because it is something to keep an eye on after we get back to normal. And that concludes this video for today. I want to hear from all of you as to what parity law means to you and what the fine print in telemedicine would do and what you would want others to know about your telemedicine experiences for chronic conditions, and put them in the comment section below. Remember, the comment section is created for and by everyday people, so make sure that you do not disclose your diagnosis, as we do not support drug and device solicitors or provide any medical advice. But your comments would be fun to see for both healthcare professionals and everyday people to join the conversation, and I can further utilize this channel to bridge the gap of communication between the healthcare professionals and everyday people as well. By the way, I have included all of the tools that you will need in this video: timestamps, notes, and continued learning suggestions in the description box below. In the next video, I'm going to share with you how you can extend your telemedicine benefits for longer and lead a more independent life, and do it confidently. This video is really exciting because it gives me a chance to go with you step by step throughout a virtual medical appointment, and the preparation tool is really exciting for me to share with you as well, as this is going to complete your appointment by insurances for you to continue getting reimbursed. And once again, thank you, health advocates, for being the best part of Patient Better. Until next time.